Hi there, everyone. My name is Alan Benjamin, and I am a consultant for CLCA and Corneal Lens Corporation. I'm going to be running through a discussion of our range of solutions and look at each product in just a little more detail. So let's start firstly with Theratears. Now, Theratears is used in dry eye treatment and is available in drops for daytime use and gel for nighttime use. Theratears gel is highly recommended for ortho-K use. We find that the viscosity provides excellent comfort with overnight wear and can play a significant role in reducing corneal staining compared to when a less viscous coupling solution is used. Now, irrespective of the cause of the dry eye disease, the result is the same. You get a loss of homeostasis and hyperosmolarity. This increased concentration of salt in the tears can obviously cause dry eye irritation, burning, and ocular surface inflammation. Theratears, it's hypertonic and unique electrolyte balance formula, which matches that of the tear film, has been shown to reduce osmolarity over time. In other words, the hypotonicity obviously lowers the salt content, allowing the solution to rehydrate the eye. You will note that the osmolarity of Theratears is 188. And after 8 weeks of use, it has been shown that a return to normal tear osmolarity can be achieved. And with this, goblet cell density and corneal glycogen will be restored, allowing the eye to stay healthy. The main ingredient of Theratears is sodium carboxymethyl cellulose. 0.25%. Now, just always remember that Theratears lubricant is designed to provide a saturating dosing for maximum efficacy. So always just remember to tell your patient that sort of for maximum hydration and relief of dryness, it is advisable that you want them to use the entire content of one vial for both eyes. And they should really do that within a 4 or 5 minute period of opening of the vial. Just moving on to Theratears nutrition. Now, this supports healthy lacrimal and meibomian glands for healthy tears. There have been 1 or 2 studies that have shown that taking higher doses of omega-3s can be more beneficial than the use of eye drops in some dry eye patients. Theratears nutrition has been designed with a combination of fish oil and flaxseed oil to achieve this high dose. Now, the flaxseed oil contains some omega-6, but there is over 3 times as much omega-3 in flaxseed oil than omega-6. Now, both the omega-3 and omega-6 in flaxseed oil are short-chain omegas. These are not significantly converted to long-chain omegas, and therefore sort of the omega-3s in the flaxseed oil are not anti-inflammatory, and the omega-6s in flaxseed oil are not pro-inflammatory. So in the end, it's really the omega-6 to the omega-3 ratio that's really important. Flaxseed oil has been shown to thin meibomian gland oils and shown to support a healthy tear lipid layer. It has been organically grown, cold pressed, and is lignin-free. Just remember that lignin-rich flaxseed oil is actually rich in phytoestrogens, and it is known that estrogens make the dry eye worse. Now, the long-chain omega-3s provided by fish oil directly suppress inflammation and directly generate anti-inflammatory prostaglandins. they actually have no effect on the lipid layer itself. In addition, the abundance of the short chain and long chain omega-3s in this product work together to competitively inhibit omega-6 generation of the pro-inflammatory prostaglandins, and they force the omega-6 metabolism to produce PGE1, which is known to stimulate tear and salivary secretion. Randomized clinical trials actually show a significant improvement in dry eye symptoms and also increase in salivary secretion in children's patients. Now the EPA is 450 milligrams and the DHA 300 milligrams are the pharmaceutically active omega-3s that directly work to suppress inflammatory blepharitis, to augment the oil layer, and to stimulate tear production. Now, by enriching flaxseed oil with these omega-3s, we get an effect that is more consistent and effective across a broad range of dry eye patients. Also, in addition, each soft gel is enriched with vitamin E to maintain the integrity of these high-quality oils. This is also important because with long-term supplementation of omega-3s, there is actually a gradual depletion of serum vitamin E. And Theratia's nutrition prevents this by actually supplementing it with vitamin E. The next product we're going to look at is Theratia's Sterilid. Now, obviously, lid hygiene is important for those with blepharitis and with dry eye, as well as those preparing for eye surgery. Sterilid is an active cleanser that kills both gram-positive and gram-negative bacteria. It kills the 7 most common eyelid bacteria in about 60 seconds. Pseudomonas, E. coli, MRSA, Staph aureus, Serratomyces, Staph epidermidis, and Moraxella. It is a natural plant-based formula which contains tea tree oil. Now, tea tree oil has been well known for years to have antibacterial properties. Linalool oil is a minor component of tea tree oil, and when it's actually combined with a membrane permeabilizer, it kills gram-positive and gram-negative bacteria after 1 minute of exposure at really low concentrations that are well tolerated by the eye. If you just look at Sterilid applications, either prior to surgery, lid hygiene beginning 3 days prior to the surgery to decrease colonization that causes endophthalmitis. Obviously with dry eye, this also decreases the colonization that inhibits goblet cell proliferation. With blepharitis, you get a decrease of colonization that promotes inflammation. With punctal plugs, here again, it decreases colonization and prevents superinfection of plugs in situ. And in the operating room, obviously it can be used in patients who are allergic to iodine. Now, the second eyelid cleansing product is the Theratia's Sterilid antimicrobial. Now, this was the first FDA-approved antimicrobial eyelid cleanser on the market. Eyelid hygiene is obviously a crucial component of ocular health, especially for patients with conditions like dry eye, blepharitis, or meibomian gland dysfunction. Sterilid antimicrobial is an effective daily eyelid and eyelash cleaner and can actually also be used as a facial wash. And it is pH balanced to be gentle on the eye. Sterilid is actually, it's formulated as a foam, whereas the Sterilid antimicrobial is a liquid, which can either be sprayed directly around the eye area, or it can be applied to a cotton pad, which then can be used to wipe around the eye and the lid margins. Hypochlorous acid is an organic substance that occurs actually naturally in the body. It's produced in the neutrophils, and it functions as an antimicrobial agent that destroys bacteria, serving as an important role in the immune system. Now, hypochlorous acid is also it's fungicidal, reducing the number of yeast cells by 99.9% within 60 seconds. And this product demonstrates broad spectrum microbial activity, once again against E. coli, Mycobacterium bovis and tuberculosis, Pseudomonas aeruginosa, Serratia marcescens, Moraxella, MRSA, and Staph aureus. Just a short comment about Ote Clean. Now, obviously, with the low bob range, which is no longer available, we have introduced a new product called Ote Clean. It's simply it's a daily cleaning solution for RGPs, including plasma-coated lenses. Also great for soft lenses and for silicone hydrogel lenses. It can also be used with lenses that have been hydropegged. Now, Ote Clean, it just really uses a safe chemical formula, which includes ordinary alcohol and non-ionic compounds. Now, these compounds react with protein or with lipids, working to remove them completely, leaving the lenses clean and ready to use. And they are available in a 40 ml bottle. The next product, you're probably all familiar with it, is the II saline, which it's an isotonic saline solution for use once again with soft RGBs and with ortho-K contact lenses. It is ideal for rinsing RGP or soft lenses after cleansing or before a lens insertion. The active ingredient is sodium chloride, and the really fantastic thing about this product is that it does have a pH of 7. And the preservative over here is polyhexanid, and I think it is at a 0.00005%. So fair to say we can almost say it's pretty much preservative free. Just a product that has a place in this market with some of the practitioners is the Oculosum Propo. Now, this is actually, it's a natural eye drop for reducing bacteria and inflammation in the dry eye. Its active ingredients here are propolis, aloe vera, and chamomile, chosen for their established clinical effects in reducing the bacterial load and inflammation. The active ingredients reportedly act on the ocular surface safely and with no sting or side effects. Now propolis, actually, it's a resin-like substance found in and transported from various plant sources by bees to their hives. So this also has antibacterial and antifungal properties. The aloe vera and the chamomile are plant-based anti-inflammatories. Now, whilst these three active ingredients have not been extensively studied together for their effects on ocular infection and inflammation, they have actually all been independently identified as safe and effective for their general purposes described. Oculosum, it's not a lubricant. It isn't intended to treat two of the root causes of dry eye, which is inflammation and infection. It has no known side effects. Precautions or contraindications would include any patient with known allergy or sensitivity to any of the ingredients. And it is not possible with the limited data to conclude where oculocin is effective, nor is it actually possible to conclude the type or types of dry eye for which it may be most effective. However, dry eye, as you know, is an inflammatory disease, and we need anti-inflammatory products which are safe for long-term use to combat that inflammation. Australia's Dry Eye Centre has extensive experience with oculocin and has found it to be very effective in mild disease and a good adjunct therapy in moderate and severe disease. And once again, this is actually available in a 10 ml bottle, which is preservative-free, and also available as in minims form. And the final products we're just going to run through is the Evolve Hypermilose 0.3% and the Evolve Carmilose 0.5%. Now, what is Evolve? This is an innovative technology providing a low-cost pathway which enables preservative-free therapy to your patient. Evolve keeps the content sterile throughout the shelf life and the 3-month in-use period. And this is actually possible due to the permeability technology, where air is able to flow through the silicon membrane, but bacteria, however, are actually unable to pass through this membrane. The blue tip technology is designed to improve accuracy of installation. The bottle is soft to improve ease of use, and this is really ideal for patients who are arthritic, and they really report that it's very, very easy to apply the drop into the eye. Evolve Hypermilose 0.3 and the Carmilose 0.5% are lubricating eye drops, which are obviously intended for use in the relief of discomfort that arises from dry eye sensations. They provide soothing relief for sore eyes from grit, itchiness, and other foreign body irritations. And they're actually ideal for both chronic and intermittent uses. They combine the preservative-free benefits of a single-dose unit with the familiarity of a standard bottle. Now, the Evolve Hypermilose contains Hypermilose 0.3%, which is the viscosity-enhancing agent and lubricant. Also, boric acid, which is the buffer, and borax, which is the buffer. It contains sodium chloride, which is the tonicity modifier, and potassium chloride, which has the same effect, and water, which is the solvent. So that concludes the discussion of the product range. If there is any further information that is required, please feel free just to send me an email or contact me at CLCA or CLC, and I would be more than keen to answer your questions. Take care, keep safe, and thank you for your time.